Welcome to this explainer. Today, we're diving into a topic that is frankly a real game changer for a lot of people. We're going to unpack the evidence on how a whole food, plant-predominant diet may actually support type 2 diabetes improvement and, for some folks, even possible remission. There's a lot of noise out there, so we're going to cut through the hype and focus strictly on practical, evidence-informed strategies. Let's get right into it.
Real quick, here's our roadmap for today. We'll start with the actual cost of diabetes. Rethink how we handle standard care. Nail down what remission actually means, and then look at how plant-based diets work under the hood. After that, we'll compare the evidence, and finally, show you how to safely build your plate.
Section 1. The cost of diabetes, a public health and economic crisis. To really grasp why this conversation is so incredibly important, we've got to look at the sheer human and financial toll of type 2 diabetes. Just consider this number for a second, $3,400. That is the average annual healthcare cost per patient in the U.S. alone for type 2 diabetes. Economically speaking, diabetes is sitting right there in the top 5 medical conditions that eat up a third of all healthcare spending. And get this, the cost per patient has skyrocketed faster than any of those other top 5 conditions, mostly because of prescription medications. So yeah, it's a massive hit to the wallet. But of course, the money is just one piece of the puzzle. The human cost is just heavy. Every single year, we're looking at roughly 1.5 million people globally losing their lives to complications tied directly to diabetes. When it goes unchecked, it can easily spiral into really severe situations. Think kidney failure, strokes, or heart attacks. But here's the hopeful part, and it's a big one. Many of these complications can be managed and sometimes even prevented if we just address the underlying biological and lifestyle factors. This isn't just an individual problem. It's a systemic public health crisis that really demands a fresh perspective.
Moving on to Section 2, rethinking standard diabetes care, moving beyond just glucose management. Let's talk about how we usually treat this and why the clinical mindset is actually starting to shift.
Okay, so for decades, standard diabetes care has been laser-focused on one main thing, controlling blood sugar. We rely heavily on medications like metformin or insulin to just keep those glucose levels stable. And let me be super clear right now. These medications are absolute lifesavers. They are absolutely crucial for a lot of people. But if we're only looking at the glucose meter, we're kind of putting a Band-Aid on things. We miss the root cause, which is underlying insulin resistance. Lifestyle care, on the other hand, flips the script. It targets your overall metabolic health through your daily habits, aiming for a deeper resolution.
Which leads us to a really fascinating question. What if the path to real, lasting improvement isn't found at the bottom of a pill bottle, but right there on our dinner plates? This is exactly the pivot point that major medical organizations are exploring right now.
Section 3. What is diabetes remission? Defining a new clinical goal. Before we get into the food, we really need to get our definition straight, because the word remission carries a lot of weight.
You know, people usually associate remission with cancer, but today the clinical consensus is realizing that type 2 diabetes doesn't necessarily have to be a lifelong progressive sentence. Groups like the American College of Lifestyle Medicine have set a very specific benchmark for this. Remission means keeping your HbA1c, that's the blood test that tracks your average blood sugar over a few months, below 6.5% for at least 3 consecutive months. And here's the kicker. That has to be done completely without the help of glucose-lowering meds, devices, or surgery.
But we have to be realistic here. Remission is not a permanent cure. If you hit that benchmark, but then go right back to your old eating habits, the insulin resistance and the high blood sugar are almost certainly going to come back. Think of remission as a state of massive metabolic improvement. It needs ongoing, sustainable lifestyle support and, of course, continued medical monitoring. It's about playing the long game, not finding a quick fix.
Section 4. How plant-based diets work. Targeting insulin resistance. All right, keeping that definition of remission in mind, let's look at the mechanics of how a plant-predominant diet actually changes your metabolism. The real superstar here is dietary fiber. When your diet is packed with legumes, whole grains, and veggies, you are loading up on fiber. And it acts almost like a brake pedal. First, it physically slows down how fast your body absorbs glucose. Because it's absorbing slower, you don't get those massive, damaging blood sugar spikes right after a meal. Plus, all that fiber feeds the good bacteria in your gut, which research tells us is huge for improving your overall metabolism. You're basically giving your overworked pancreas and liver a very well-deserved vacation. But hey, it's not just the fiber. A plant-heavy diet is naturally low in saturated fats and packed with protective phytonutrients. This specific combo directly boosts your insulin sensitivity. That means your cells actually start listening to insulin again, letting glucose leave the bloodstream where it's causing trouble and enter the cells where it's needed for energy. And the best part? You don't have to starve yourself. You can eat really satisfying meals without obsessively counting every single calorie. The ultimate goal is full-body cardiometabolic health, protecting your heart, your brain, your kidneys, not just chasing a good number on a glucose monitor.
Section 5. Evidence and diet comparisons. Evaluating different dietary approaches. Let's stack this up against other popular diets because, let's be honest, the internet is full of conflicting advice.
Low-carb and keto diets get a lot of airtime when it comes to diabetes. Now, it's totally true that cutting carbs will drop your blood glucose in the short term, but the research points to some pretty significant long-term trade-offs. Keto can actually drive up your LDL, or bad cholesterol. It's also super restrictive, making it really tough to stick with for years, and you miss out on a lot of diverse nutrients. Whole food plant-based diets, though, they show incredibly positive long-term effects. They improve your cholesterol, they lower blood pressure, and they reduce inflammation. The aim here is lasting metabolic health, not just a temporary hack for your blood sugar.
And we actually have real-world data to back this up. The source article talks about a wellness clinic where everyday patients, not perfect, hand-picked research subjects, were prescribed a high-fiber, plant-based diet by their doctors. The results? Kind of mind-blowing. Over a third of these regular folks reached non-diabetic blood sugar levels, and the rest of them, they continue to make really steady, measurable metabolic progress. Honestly, the most compelling part is that in this real-world, messy clinic setting, almost half of the patients were able to completely stop their diabetes medications. Now, just to be completely fair and balanced, this wasn't some tightly controlled laboratory trial, and not every single person hit that official 3-month remission mark. But still, it proves that standard medical care can absolutely successfully incorporate lifestyle prescriptions. Section 6. Building your plate safely. Practical steps for a plant-forward lifestyle. So how do we actually do this? How do we apply this to our lives in a way that's doable and, most importantly, safe?
A good rule of thumb is aiming for a plate that's about 95% plant-sourced. You want your heavy hitters to be legumes, black beans, lentils, chickpeas, because they are absolute powerhouses of fiber and protein. Throw in some intact whole grains like oats or quinoa. Then just color it in with as many different fruits and vegetables as you can find. Add a small handful of nuts or seeds for healthy fats. On the flip side, you want to really dial back the animal products, especially red and processed meats, and try to keep oils and ultra-processed boxed foods to a minimum. It's not about being 100% perfect, it's about shifting the overall balance.
Keep in mind, food is just one part of the whole shebang. If you want to build a real foundation for possible remission, you've got to pair the diet with moving your body. Even just a daily walk does wonders. And please, don't ignore your sleep. You really can't out-eat bad sleep hygiene. It all works together.
All right, listen up because this is absolutely crucial. If you have type 2 diabetes, and especially if you take meds or insulin, do not overhaul your diet without talking to your doctor first. As your diet gets cleaner and your insulin sensitivity improves, your blood sugar can actually drop fairly quickly. If your doctor isn't adjusting your medications to match, it can be incredibly dangerous. Consider everything we've talked about today as the perfect starting point for a chat with your medical team.
So, I'll leave you with this to chew on. The evidence is making it pretty clear that food is way more than just a lifestyle choice. It's a profound therapeutic tool. If we stop just managing symptoms and start truly nourishing our bodies, we open up a path to something a pill alone just can't offer: genuine autonomy and freedom over our own health.
Well, that wraps up our explainer. If you found this breakdown helpful and you want to dig into the actual research, read the expert consensus, or grab some practical meal ideas, I highly recommend checking out the full article over at Health and Fitness Authority. Thanks so much for joining me today, and here's to making informed, powerful choices for your health. See you next